I wish I had known my feet were trying to tell me something years ago. Those words from my client last week hit me like a punch in the gut. And this is exactly why I had to make this video for you today. In this video, I'm going to walk you through the top 10 subtle food changes that often appear years before a diabetic diagnosis, warning signs that are easy to dismiss but crucial to recognize. I'm sharing this with you because after nearly many years of working in this industry and coaching clients, I have seen these patterns over and over again. I have also witnessed firsthand how these quiet food symptoms can predict serious health issues down the road. Now, if you stay with me to the very end, you will know exactly what to look for during your own food check tonight, and more importantly, you will understand why these seemingly minor changes could save you from major complications later down the road. Alright, sign number 1, tingling and numbness. That feeling when your foot falls asleep, that pins and needles sensation. Now imagine that is happening when you haven't been sitting funny or crossing your legs at all. In my nursing days, I saw this all the time. Patients would come in saying, "Oh, my feet just feel weird sometimes," right? What they are describing was often the beginning of diabetic neuropathy, basic high blood pressure starting to affect the nerves. Now, here is what worries me about this one. When you can't feel your feet properly, you can't feel when something is wrong with them, right? So I've seen people with cuts we didn't even know that we had. Swelling that don't go away. We are all a little puffy sometimes, especially after a long day. But I'm talking about swelling that is just there, day after day. When I was working at bedside, this was often one of the very first things we would notice. Persistent swelling can mean your circulation is not what it's supposed to be, or your kidneys are working harder than they're supposed to. So both of these can be tied to blood sugar issues. Number 3, cut and sores. That takes forever to heal. This one really hits home for me. I remember coaching a client who mentioned a small blister from a new shoes that she got. I've always told patients, if there's something on your foot that is not healing in a reasonable time, that is worth a conversation with your doctor. Number 4, really dry and cracked skin. I know dry feet, that don't sound like a big deal at all. Trust me, I get it. But here is what I learned from years of wound care. Those cracks can become doorways for bacteria. So when I'm working with clients, I always emphasize on foot care. It is not vanity, it is prevention. So keep those feet moisturized, because fixing a problem is always harder than preventing one. Number 5, feet that are always cold. Are you the person who wears socks to bed even in summer? Always complaining about cold feet? Sometimes it is just genetics, but sometimes it is telling you something about your circulation overall. I've learned to ask my clients about this because it can be an early sign that blood is not flowing to the extremities the way it's supposed to. Number 6, changes in your skin colors. This is one of those things that is easy to miss unless you're really looking. Maybe your feet look redder than usual or have a bluish tint of a same paler. The skin color reflects what is happening underneath. So how well oxygen is getting to those tissues. After years of assessment, I've learned that these subtle changes often tell a story before a person even feels the symptoms. Number 7, hair loss on your legs or toes. This one might surprise you. I remember the first time an older nurse pointed this out to me in my early beginning of nursing. She said, "Look at his legs. No hair below the knee. When blood flow decreases, even your hair follicles don't even get what they need to get." So it's not like the most obvious sign, but it's definitely something that you want to watch for. Number 8, pain when walking. I'm not talking about general soreness after a long day. I mean that cramping, aching feeling in your calves or feet when you are just walking normally. This was something I saw a lot in cardiac patients too. So when your muscles are not getting enough oxygen-rich blood, they'll let you know. It is called claudication and is worth taking seriously by checking with your provider. Number 9, changes in your foot shape. This one is really subtle but very important. Maybe your arches are not as high as it used to be, or your toes are starting to curl differently. These changes happen when the nerves and muscles in your feet are not working quite right. And here is why it matters. When your foot shape changes, pressure points will change too, and that can lead to sore and ulcers down the road. Number 10, frequent fungal infection. Always dealing with this with athlete's foot, toenail fungus that keeps you coming back, itchy skin between your toes. Here is something I learned that surprised me early in my career. High blood sugar creates the environment where fungi just love to grow. It is like giving them the favorite food, right? So keep your feet dry, rotate your shoes, and don't ignore infection. Treat them very early on. All right, you know what? After all these years of working with patients, with people with diabetes and their health conditions, I have learned that our bodies are constantly communicating with us. The trick is though, learning how to listen to it, right? So your feet carry you through your life. They deserve your attention. So tonight, maybe take a few minutes to really look at them. Check for any of these signs that we just talked about. And if you're noticing any of those signs at all, any of those symptoms, especially at night when you're trying to sleep, I've got another video that might really help you connect the dots. And do not ignore this. You definitely want to check with your doctor. So that video is called the 7 night signs of diabetes that people miss all the time. Things that happen when you are sleeping that could be giving you some very important information about your health. So I'll put that video right here. You can click on this link right here to learn more about it, so to be aware and know what to do. All right, so thank you for watching. Hit like and subscribe and share this with someone who needs it the most. Take care of yourself, and I will see you in the next video up here.